Well, it's good to see. Got it. Okay. Got it. It's good to see everyone here. Of course, Michelle and Justin are both here. Paula, good to see you. Dr. RV, Christy, love it when you're on because you just, you make this group a little bit sharper and dig a little bit deeper. Carol Wright, Eddie Joe is here. We love your input, Eddie Joe. Patricia from London, UK is here. Barbara Brock and Sharon Skorowski is here. We're all in the house. So these are all familiar names so far tonight. And just so glad to see you. Yes, last week was an awesome segment. I'm almost, I wish we had filmed it, but on some level, I'm kind of glad that we didn't because it created a safe space for men to talk about some of the things that they face and the challenges that they're facing. So I think so I'm kind of glad that it wasn't because it did create a safer space and they talked about the need for a safe space. This week, we're going to talk a bit about, we're going to do the follow up on Coachella. Okay, so, several weeks ago, we were talking about, I mentioned Coachella. Coachella was happening, this outdoor music festival in California that was going to happen right in the middle of the weeks that Omicron should be surging, specifically BA2 and BA2 and its partner BA2.12. So that happened. Coachella happened the last 2 weekends of April. So if someone can hand me let me turn on the share screen. Will I be able to do that? Yes, I will. Yes, I will. Okay, great. Share. Okay. You're sharing your screen. Zoom is sharing your screen. Okay, great. Okay. And we are going to go here. So, so we're going to before we get into the full discussion about Coachella, I wanted to start with just kind of go over what our agenda is going to be for tonight's evening. We're going to do a COVID update and review as usual. We're going to revisit when do we know COVID is over discussion and what can we learn from Coachella and this thing called the Coachella cough. It is a thing, and I just wanted to review very quickly. How can we know when the pandemic is over? Do we have a cure for COVID? Have we turned to pre-pandemic levels of flu hospitalizations and deaths? No. COVID no longer detected in the wastewater. That has not happened. Return to pre-pandemic levels of social activity. Well, we might end up doing 4 before any of the first 3 happen. So just because we end up doing 4 does not really mean that the pandemic is over. It's just that if we do 4 before we really have a cure, before we really return to pre-pandemic levels of flu hospitalizations and death, and before COVID is no longer detected in the wastewater, if we're returning to pre-pandemic levels of social activity, then we're just acting out of a sense of denial, unless of course people have decided to take on the safety measures and use the biosafety practices. So where are we at? So right now, as typically we wanted to look at what is the data showing as of March 7th. I mean, not March 7th, May 7th. So we see that now BA2 is, predominant and its cousin BA2.12, that those are the 2 predominant variants. So they make up 85% in total, they make up 85% of the cases. Delta is now almost negligible. You can barely detect it in the United States. And we know that both the BA2 and the BA2.12 is all over the United States and represents the majority of the cases throughout the United States. Okay, so this is what the overall picture is looking like. Okay, and as usual, we want to take a look at where we are in terms of cases, hospitalizations, and then deaths. So we are just shy of 1 million people having died from coronavirus, with like 3,000 out. So I presume we're going to hit that number either today or tomorrow. The 7-day rolling average shows in the U.S. shows that we're up 18% in cases. In terms of hospitalizations, we're up by 8%. But deaths, last 7 days, we've seen a decline of minus 23, which is good news in the sense if we talk about overall in the United States. That's really good news.
Dr. Blessing,
Yes,
Christy had her hand raised. I think she have a question.
I'm sorry. what was-
So, Dr. Blessman, I meant to send you an article, and you and Michelle, but there are 2 new variants in South Africa that are BA4 and BA5.
Mhm.
And this is what I'm going to say as a scientist. We're never going back to pre-pandemic hospitalizations because the virus is outpacing science.
That's
And
right.
for us to even think that is like ludicrous. That's illogical. And so many people are getting sick there. And I will send y'all the article so that y'all can see it. And everybody can look at it. If I'll transfer it from my cell phone, but that is what I knew would happen as we start to become more socially active and people going to other countries and these different viruses are mixing. Even though those of us that have been vaccinated, it's like people are still getting sick.
Exactly. Exactly. Um, you're right. We may not ever go back to pre-pandemic levels. We certainly do not have a treatment, and I'm going to talk about that a little bit later in our conversation tonight. Um, and you're right. There are new variants that are coming on board. So we have no idea. We know that they're here in the United States. We just don't know what the prevalence is at this point. And we don't have an idea. We do know that it is evading immunity. So that those people who have been infected before with COVID are not necessarily better protected now. That the new mutations that they've spotted on these particular on BA4 and BA5 makes it much more transmissible. We thought BA2 was highly transmissible, but these are becoming even more transmissible. What has not changed, and people have studied the 7 F's and an R, the routes of transmission has not changed. So the ways that we need to protect ourselves still apply. Um, okay, so you're right. We expect that, and Christy, I'm glad that you're watching the South African data. I do too, as well as the Israeli data, because they are maybe about a month ahead of us in terms of what we see happening there. We
Yes,
start
ma'am.
about a month later. So that's, you're right on target in terms of watching the South African data and the Israeli data. South Africa, I believe, has not stopped its genomic surveillance of this virus, whereas a lot of other countries have. And I believe Israel has not stopped its genomic surveillance as well. And so those are important data points that we have access to. Um, and we should be taking a look at that. Okay, but I want to go back and say, we looked at what the data said for overall in the United States. So understand that, COVID is not over for the United States, and it's certainly not over for Black America. So we know that it's been whatever the data says for the overall United States, that it's exponentially worse for people of color and communities that they reside in. Hospital rates are higher than it's ever been. Older African Americans are 5 times more likely to die from COVID. African Americans lost 3 years of life expectancy compared to whites who only lost 1 year. Um, and this is not due to some genetic or biological defect, but due to structural realities such as there are fewer hospitals. Many African Americans live in food deserts and don't have food insecurity, so they don't have necessarily all the resources needed to create a healthy environment in which they can even recover from COVID should they get it. Um, beds and fewer beds, hospitals, and equipment. And there's also discrimination in getting care. We saw that firsthand. Many of you saw the videos of the African American doctor who could not get care, and she was a doctor and could not get care. Some of us may have, I don't know how many of you out here have watched The Color of Care, which is the documentary that I think Oprah Winfrey was the executive producer, but it's a good one. And it talks about how challenging it is to get healthcare, to get really good healthcare in the United States if you're an African American. And I can attest to that. There's a very big difference in because I have friends that are I have Black friends, white friends, Southeast Indian, Southeast Asian, Japanese, I have friends that run the gamut. And I have walked with a number of people of varying backgrounds through the process of getting hospital treatment. And I certainly can see the difference between what it means if you're Black in America trying to get good quality care versus what it is if you're, average white American just going out and getting care. There's way more options offered. They're way more willing to extend premium and high quality care. You don't necessarily have to continue to look for or search for the best care possible. It's just presented as an option. Whereas there's all kinds of things that happen or get in the way if you're African American and you're seeking care. There is an awesome resource that just came out recently, the State of Black America and COVID-19, and they looked at what has happened over the last 2 years, and it's a report from the Black Coalition Against COVID. Some heavy hitters have participated in writing this report. But I just want to say that one of the things that struck me about, I just took a cursory glance of this, and I'm hoping that we will have a conversation, a broader and bigger conversation about this later on. But I just want to hit one of the highlights, because even though we look at the data every week on cases, hospitalizations, and death rates, one of the things that they found in this study was that whatever the data said in general for America in general, that the data was 3 times worse in the Black community, basically. So if the death rates were 5%, then it was 15% in the Black community. If the hospitalization rate was 3%, then it was 9% in the Black community. If the cases were 2%, then it was 6% in the Black community, basically running about 3 times higher. So even though we look at the overall US data, we should not assume that that's the case for Black America. So like we saw the death rate went down by 23%. That doesn't necessarily mean that the death rate went down the last 7 days for African American communities. Okay, so just keeping that, we just need to keep that in mind as we watch this data every week. Okay. So I hope that I think I posted the links, and we will post it again if you can't see it. The links are posted in the chat for both the article about that it's not over for the Black community, and this report is also, or the link to this report, the State of Black America and COVID-19, a 2-year assessment, is also in the chat, or will be soon in the chat. And I'm hoping that we will, that this group will take a look at that, read it, and eventually have a broader conversation about this. Michelle and I are working on getting Thomas Fisher, he's an emergency room doc here in Chicago, on the show. He's recently, on the Zoom webcast, he's recently written a book called Emergency, A Year of Healing and Heartbreak in a Chicago ER. I've started listening to it and it is riveting. He's an excellent writer, but also the stories that he tells about what COVID has been like from his perspective as an emergency room doc, and also all of the factors that go into um, it will make the State of Black American COVID a 2-year assessment. It will give color and life and meaning to the data, to that data that's presented there. And he explains it in such a way that it really hits home and is very poignant in terms of understanding how race, class, and COVID has intersected and what it has meant for the Black community and basically people of color in the last 2 years. So I'm hoping that if those of you are interested, will pick up a copy of that. I'm listening to it on audiobook, and it's really, 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 really good. So given that, we see that the cases are going up, hospitalizations are going up, and we can assume that we can pretty much assume that if they're going up in general for the white community, then they're going up a lot for the Black community. Okay, at least 3 times worse. So what does that mean? Okay, one of the things that we had talked about was, how important it was to take a look at what's going to happen after Coachella, because I thought of that as a really big experiment. Like, okay, all these folks are going to gather with no mask, no vax requirements, no testing requirements. This is a picture from Coachella, and it's in the middle of Omicron. So, and as you look in the picture, you might see a few people, like there's a guy in the bottom right, he's got a mask on. And then there's a guy midway back, sort of in the third, with a blue handkerchief type thing over his face. There's another guy with a white handkerchief over his face. I think she has on a mask. This woman has on a mask. There's somebody back here with a mask on. So there were a few people who did put on masks. Not a lot. Not a lot. Now, what's interesting about Coachella is that Coachella happens in a desert. And so there were a couple of people that did come to me who, I can't mention any names, some celebrities who came to me who wanted to have some advice about how they could attend Coachella and more safely. And I talked to them about the fact that, you're in a desert and there's something called the Coachella cough, which comes from inhaling all of the desert dust. So why not wear a mask, and put something cute over the top of it, because you just want to protect your throat and your lungs from Coachella cough, from breathing in all of the desert air. So that was one way of, of explaining it to folks in a way that said, oh, okay, and they decided to do that. In addition to, and they had, a good quality mask, and they did the testing, and they did mask testing and ionizers when they were maskless and around, other folks that, where they couldn't isolate and they were eating or whatever. So, so it's interesting. I want to just ask the folks out here, what do you think happened after this? How, do you think there was a spike? And if you think there was a spike, how much of a spike do you think there was? Anybody want to venture a guess?
Dr. Blessman, I know that there was a spike, and I would imagine that it was in the upwards of 25 to 30% of a spike of the number of COVID cases.
Okay. Anybody else want to take a guess?
I was gonna say about the same thing that she did.
Mhm. About 30%.
Me too. I was gonna say 28, but that's close enough.
Mhm.
Okay. 28. Okay. Okay. Anybody else? We good? Okay, so after the first weekend, the cases spiked by about 70%.
Oh my God.
After the second weekend, cases spiked by 139%.
OMG.
My goodness. Mm.
Yes.
Mm.
But Dr. Blessman, didn't they realize that, I mean, if you have the people at the White House and in the Congress, that they're all communing together, having get-togethers and not wearing masks, and they're catching COVID, you should have known you're going to catch COVID at some big as Coachella. That's just common sense.
And they, understand that they did say, Coachella folks did say that on their organizing sheet, they said, that this is an event where you can expect, they're offering no guarantees that you won't, oh, wait a minute, that you won't, there's no guarantees that you won't get, COVID. So they absolve themselves of any responsibility for you catching COVID. Basically, they basically worded it in such a way that it was about you come at your own risk. They just wanted, Coachella organizers just wanted these folks' money, which they got, because these are not cheap tickets. And they sold out within, I want to say within an hour of them opening the ticket registers to purchase. So yeah, you pretty much can assume that. Now, a lot of people thought that because it was outdoors, that somehow Coachella was going to be safer because there was an outdoor event. Now, remember, some of us wouldn't fall for that, because some of us remember 2 years ago when, in the White House, when they had the Rose Garden event to announce that Amy Coney Barrett, I think it was a reception for Amy Coney Barrett, and that turned into a huge super spreader. So there, we've at least had some indication that if you are outdoors and you're not spatially distanced, that you could possibly catch COVID. But then the other idea was, well, if you got people vaccinated, then that's going to help. But, we all know that vaccination doesn't stop infection rates. So, so it went up 139%. But we all know that distancing, is not likely in most of these outdoor festivals, charity walks or runs or any outdoor concerts or, anything like that. So, art festivals, we have a number of them coming up in Chicago. Every year there's Jazz Fest, Blues Fest, Gospel Fest. I'm pretty sure they're going to have the African Arts Festival over Labor Day weekend. Brew Fest is coming up, which is now called the Hyde Park Summer Fest. The Silver Room is getting ready to do a festival similar to, and these are all in the Black community. Brew Fest, Silver Fest, Blues Fest, and Gospel Fest will largely be African American. Jazz Fest may be mixed. But if we know that this is happening, if we know that Coachella created a spike like this, then it would make sense that, or you would think that it would make sense that people would try to, the organizers as well as the participants, might need to do something a little bit different if they want to um, participate in something like this. So, so we can't assume that outdoors is safer, especially if it's not likely that there'll be enough space to spatially distance. Um, Cases spiked by 139% after the Coachella Festival, which had no mask, vax, or testing requirements. So they did nothing. So, okay, so what does that mean? We've looked at outdoor events in the past as being a little bit more protective than indoor events when it comes to the transmission of COVID-19. But Cindy Prinz, a clinical associate professor, mhm. But Cindy Prinz, who's a professor of epidemiology at the University of Florida, said that Omicron really changed that calculation. If you go to that kind of event, you have to expect that you will get exposed to COVID. So we know that. So this, I'm sorry, did somebody, I thought I heard somebody wanting to say something. No?
I think it was an echo.
Okay, okay.
Mhm.
So, so you know that you're probably with if you're at an event that has that kind of crowd, um, you're probably going to get exposed. So what do you do? What do you need to consider if you would like to do that? Because I'm definitely one of these people that say, okay, wait a minute. It's not that you can't do it. It's just how you're going to do it, and how you're going to do it in a way that's that's safer for you and for the people that you live with. So those are the things that you need to consider: your own health status, the health of your household members, and what equipment you will need in order to enjoy life more safely. So recently, the CDC did post um, something about health conditions. Let me see if I can pull that up. Health conditions. Here it is. People with certain medical conditions that you might, so if you or somebody that you live with have any of these kinds of medical conditions, this puts you at more risk, even with a vaccine, more risk of getting a serious case of COVID, cancer, chronic kidney disease, chronic liver disease, chronic lung diseases. Okay, I want you to think about this: asthma, if it's moderate to severe, COPD, common, blood clots in the lungs, high blood pressure in the lungs. Okay, think about it: liver disease, chronic kidney disease, cancer, um, cystic fibrosis. I don't know why these make you more likely to get very sick from COVID, dementia, or other neurological conditions, but it does. Diabetes, certain types of disabilities. Um, I think some of it has to do with if you get it, like with cerebral palsy or some birth defects, you're not able to clear your lungs and cough. You don't have as much muscle control. So that's more like heart conditions. Um,
Dr. Blessman, all of those things that you're talking about, even having Alzheimer's, it impacts your immune system. So everybody's immune system that you're talking about their immune systems are all compromised and weakened.
Correct.
So that's what makes you more susceptible, because if you get it, your body is not going to respond and fight it like someone that had a normal immune system.
Correct. 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 So, you're absolutely correct. And the other thing that I wanted to point out is that for a number of people who are taking, particularly for some of those conditions that was listed there, those folks are taking medications that would prevent them from being able to take Paxlovid, which is the treatment, which is now the standard treatment for a treatment regimen for preventing serious COVID should you get infected. So that's why it's important to think about your health, but also think about the health of the persons that you live with so that you're not bringing anything home to them because they may not be able to take the treatment should they get COVID. Okay. So I just want to just to give you an example, and I want to use myself. So I was invited to an outdoor Mother's Day workout, and that's me in the green shirt. And this is my trainer, son. This is our trainer, Sonny. He was leading it. No, I didn't know how many people were going to come, but you figure, okay, it's outdoors, we can spatially distance. But at some point, as usual, people are milling around. And I think it takes only like 3 minutes of exposure or talking to somebody that has COVID to actually get enough exposure to be able to get COVID. So not knowing how many people are going to show up, not knowing whether we're going to be, adequately spatially distanced or not. And even if we are, we've all learned that, 6 feet only protects you from big droplets, not from aerosolized spray. If you look very closely, you will see that I have my ionizer on. I don't know, does the arrow show up? Oh, that's us working out. Okay. Yeah, we were kind of
I see your ionizer. I see
there
that.
it is. Okay. So basically all I did was I took 3 safety pins and pinned it down to my shirt. Okay. Because I said, life would, okay. And there's a reason why I decided to do this. I have a husband who has a heart condition, high blood pressure, and I'm concerned that I don't want to bring anything home to him. And so I wear the protective equipment to make sure that I'm not bringing anything home to him. So I can live and thrive, and so can he. But, we are not, we're not bringing anything home to him. Now, my trainer, I've been talking to him, and he wanted to invite my son to a 10K race. And so I told him, Sonny, I said, my son goes with you on this 10K race. He has to wear his ionizer. And he said, oh yeah, I'll make sure he wears it and keeps it on and da 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 da. And then today I told him, I'm going to wear that you're going to run in. And I showed him how, just like he saw mine on Sunday. I said, you're going to have the same setup. I'm going to do that to your shirt so that when you're running in this crowd of people, your chances of getting sick will be reduced dramatically because the ionizer will keep any viral particles away from your airways. Now, there's a reason why I have to talk about this, because I know someone who is VP of nursing, vice president of nursing for a major healthcare chain here in Chicago that serves the African-American population. So it's on the South Side. She was in a 10K or 5K a couple of weekends ago, and she's just now getting over COVID. And she swears up and down. She was in the same park that we see here. This is Buckingham Fountain is part of Grant Park in Chicago. So and it's a popular site to have 5Ks, 10Ks, marathons, and that kind of thing. And so she was walking. I think it was an American Heart Association thing, and she got COVID. She has bronchitis. She thought she had allergies, and then she took the test and found out that she got COVID. Now, thankfully for her, she was able to, it was a little touch and go, but she got Paxlovid. She had to be monitored and watched because, fortunately she doesn't take any medication for her bronchitis, but for some people who do, they may or may not be able to take Paxlovid. So, those are the things we need to think about in terms of what we do and how we move through life. It doesn't mean that you can't do things. It doesn't mean that you have to be stopped, but just are you willing to take on the precautions you need to take given your own health status, and the health status of the people that you live with. And as who was it that said last week, do you want a dead parent, or do you want to wear this mask, or do you want a dead parent? Do you want to wear this ionizer, or do you want a dead parent? So yeah, I think that those are the important things that we have to do. So that's it for my Coachella and COVID exercise and being outdoors. We are, as we move into going to the summer, and we see more and more opportunities to do things like we love Ravinia, which is an outdoor concert arena where you can take a picnic lunch or picnic dinner and sit out on the lawn and listen to great music. We want to be able to enjoy our summer. And what I just really suggest and encourage is that even though you are outdoors, and even though it might seem like you're spatially distant, we know that viral, aerosolized spray can travel a distance. Space only keeps you from, a direct hit, but aerosolized spray is enough to infect you. And as we have these variants that are coming in, B4 and B5, which are threatening to be even more infectious, it's on you to decide that you're going to make the investments so that you can live the life you would like to live. Or as somebody once told me, well, if you don't want to make the investment, then keep your ass at home and be done with it. So there you have it. We know. Any questions? Let me take a break right here and take a pause.
Dr. Lessman, you said something about the bigger part of the particles of, well, it's, will drop or whatever, but you said the aerosol, you're talking about even, from your mouth, or from, where would the aerosol come from?
So aerosolized spray. So it just means that little tiny droplets that can be just floating through the air from just regular speaking. They were basically, when they first started talking about masks, they were trying to keep people from coming in contact with large droplets that came from a cough. So think about when people cough and they shoot out this spray, and those are large droplets.
Right.
So if you're 3 feet away, 6 feet away, you're probably not going to get hit by aerosolized spray. I mean, the small droplets. But if you're just in a conversation with people talking, we are respirating, and so our breath has a little bit of moisture, a little bit of mist, even in the summertime, and that is what can be enough to 3-minute conversation with somebody who is infected can be enough to infect you.
Yeah.
And that's not necessarily somebody that's singing or laughing loud or coughing, just simply in the act of talking. If you think about if you are on a charity walk, or if you're on a charity run, and people are respirating, particularly on the run, respirating even more heavily, and you're in a crowd of people, that's all those, the aerosolized spray, that really micro tiny particles will be in the air. And so the idea is that with an ionizer, you're going to move all of that away from you, away from your airspace.
Yeah.
Does that answer your question, Ms. Brown?
Yes, ma'am. Yes,
Okay.
ma'am.
Great. Great. So
My
go ahead.
I was gonna say, my grandson is graduating and we're gonna have a dinner for him. My daughter is getting a tent ready and everything. It's gonna hold about 60 people. And we're gonna be like out in the country here in Tennessee. And I just hope that things will go all right there. I mean, there's probably some that have masks. Our family, we got the ionizers and our masks and whatever. But it's gonna be kind of tight. We will have a lot of room, to move around. My daughter's hoping that the tent would be able enough for everybody to be scattered out, somewhat, and not be under everybody. But like I said, we're expecting between 40 and 60 people.
Okay. So there are the ionizers, I've seen them as low as $13. I think and some even as low as $10. I'm right now in the midst of planning a family funeral for my my cousin who grew up like sisters. And I know that the family is not even, they're distraught. I mean, so they're not even thinking about COVID per se. So I just went ahead and just ordered like 20 ionizers for everybody in the family so that they will all have one. Yeah, so in lieu of flowers, because my cousin's sister has been getting her flowers for the last year, every month. So I don't need to buy her flowers for her funeral because I gave them to her while she was still alive and could enjoy them. But I can get something for the family, for every family member that would allow them to be able to attend this upcoming funeral service without it becoming a super spreader event. Now that will probably be indoors. I get it. Now, if you're outdoors under a tent, at some point everybody will still be, even under a tent. You mentioned everybody has ionizers. That's great. That's exactly, and you especially want to make sure that any older members of your family have one. You especially want to make sure that they have one. Preferably everybody should have one, but you especially want to make sure that older people in your family have an ionizer. I'm not saying that you should go out and buy one for everybody, but you can certainly let them know that this is is what would be helpful. That this was what would be helpful, because yes, it is safer to be outdoors to some extent because you have wind blowing, but it's not as safe as we had assumed that it might be.
Mhm.
So safer than indoors, but still it carries a certain amount of risk, and we want to reduce it as much as where we possibly can. We scientifically know what we need to do in order to reduce the risk. That ionizer and skin guard for everybody, that's enough to reduce the risk because you're taking care of your hands and you're taking care of your airways. So that's it. Now, Shirley, if you don't mind, I'm going to show people the back of the invitation to the party.
Absolutely. And I can
Um,
definitely share any comments, negative and positive, that I have gathered and learned. I think overall, Dr. Blessman is going to be responsible for teaching people what an ionizer is, how to pronounce it, because I had people who had never heard of it, didn't understand why, and then they were able to go in and read the information, and then they went out and bought for grandma and Aunt Suki, and now everybody got an ionizer.
Mm-hmm. So Miss Shirley has a big, significant birthday coming up, and we decided, so we talked about what would need to happen in order to make it as safe as possible. Of course, we cannot guarantee anything, but we know what science and technology is available, and we know that the technology does work. So what can we do to make it as safe as possible and for everybody to have as as she calls it, we look forward to celebrating and misbehaving with you on June 11th, 2022. So I'm ready to get my misbehavior on, okay? So, so she's, she's talking about in her party requirements. Um, she's we're providing large room air purifiers throughout the venue. So we're already trying to make sure that the air itself is going to be cleansed, and we have the type of air purifiers that definitely takes care of viruses in the air. But we're also requiring all guests, she's requiring all guests to be fully vaccinated and boosted. There'll be verification at the door. If you're not vaxxed, it's important that the person present a negative COVID test taken the day of the event. We talked about a temperature check at the door. Additionally, all guests will receive an application of Skin Guard, a hand sanitizer that continues to kill COVID for 6 hours and will last through 11 hand washes. Prior to the event, purchase your wearable portable ionizer air purifier. It acts like an invisible mask. It lasts this one that we took them to, it lasts 48 hours on a 2-hour charge. If you want us to purchase it, please let me know. The cost approximately $25 on Amazon, but always on sale. Link to order is below, and that's the link to the one that we picked out. And then we note that guests who have a medical device should not wear an ionizer. Please wear your mask. But if we have just a few guests that might not have an ionizer, might not be able to wear an ionizer, they'll still be able to eat and drink in relative safety. Please stay home if you are feeling under the weather the day of the party. Shirley would be more than happy to celebrate with you at a later date. And then, my information in case they had any questions, and and then your attendance is confirmation that you have agreed to comply with all party requirements. Now, people might wonder, oh, how are people going to react? Because, when I talk about having the COVID requirements, doing these kind of COVID requirements, first thing people want to know is, well, how are people going to react? And, and they almost feel like having these COVID requirements will be a turnoff. But Shirley, you tell the audience what happened now that you've put this out there. What has happened to your guest list?
A couple of my really best friends, which, I still think that we're best friends, but, sometimes women can be pretty catty and petty. And they're in Houston, and they are just walking around with no mask and doing what they want to do. So one of the ladies called and said that she felt that the requirements were very intimidating and that it was going to scare people off. And I remained very calm, and I listened to her. And I basically said to her, listen, we have put together a team of people, experts, and these are the measurements that we've come up with. I clearly understand that this won't work for you, and I won't be offended at all if you decide not to come. And she decided not to come. That was fine, because that's like somebody showing up and then you got to fuss with them about wearing masks or taking the ionizer off. That's not what I want to happen. I want everybody, not just myself, but I want everybody to feel that they're responsible for each other and for themselves. Then I have another group of people who said, I'm coming because of the requirements, because at least I know that you all have thought about it. And I'm more than happy to comply. there's been a few people who said, you know, what is an ionizer? Where can I get some information? Why does it work? One gentleman called and said, how do you pronounce this word? You know? So, you know, you go through all of that, but I can tell you, the RSVP has gone through the roof. I've had to cut it off. I have a couple of people on the waiting list. And I thought a lot of the out-of-town guests would possibly just send some coins.
I know that's right, Miss Shirley.
And not show up, you know.
Right.
That would have been fine.
Mm-hmm.
But as it turned out, they're coming.
Right, Queen.
So at least 30 plus people have bought their plane tickets,
Ooh.
have hotel reservations, and they're coming in. And so what I learned from this is when people really know and understand, they have a choice to make. It's, you know, there's no reason to browbeat them and go through 20 questions because they don't want to hear one. But just be firm enough to say, this is the requirements. I'm sorry, it won't work for you. We'll see you next time. And I think they really want you to beg them. Who's gonna do that? It's my damn party, right? I'm not gonna
that's
do that.
right, Queen.
So it surprised me that has been the response of a few people, but it's okay. I mean, I had a very good friend of mine who called and said that, you know, Shirley, we love you. We really want to come, but we can't meet the requirements. And my first thought was, you know what? I'm not going to even go there. I just basically said, you know, I clearly understand. This is what the team has come up with. And this is what we're going to go with. So I don't want you to come and be embarrassed. Then I found out that they had been vaccinated, but they had not gotten their boost. So then they called me last week and said, we've gone ahead and got our boost. And I said, well, great. I'm going to be asking everyone to send their vax cards to me so we can make the check-in process a lot faster. So I'll get a chance to get those vaccinations, not someone just sticking something in your face. We got a lot of people in line, right? But I'm really happy to see this many people excited about wearing their ionizers and knowing we're going to have the purifiers and the skin guard. All of this is stuff they've never heard of before. So I believe that while it's about me, that there's going to be a lot of people that are going to learn what we talk about every week.
Through your event.
Huh?
Through your event.
Exactly. So mission accomplished.
Yes.
Because I have one friend who's gone out and bought 17 of them.
Ooh.
For all his family, his grandmother, his aunt. Had never heard of this before. Mm-hmm. So, you know, I guess we can't assume that people don't want to. Mm-hmm. They just may not know to do it. So, and I've been really clear about everything. And this is when you have to put on your big girl panties and stand and let people know how it's going to be. And don't be uncomfortable with that. It's no compromise. So, but you know, this is thanks to you, Dr. Blessman, because prior to me meeting you, I know I do things, but I've never tried to do an event. Okay. I mean, I was like, praying,
Mhm.
God, my intentions are well, you know, let me decide. Because one minute I said I was gonna do it, the next minute I was like, oh no, I don't want this to be a super spreader. And you know, but the one thing that I have learned is you can never say never, but if you do your best, and we know this works, we know this works, we're all doing it. So that's where we are. We can hold 100, and there's 7 people on the waiting list.
Wow.
Yeah,
Wow.
that was the part. Not only is it that that you had to cut off, you've already had to cut off
The
the
invitation.
invitation list, but you know, you had a date, you had a response date that was like
Of
several
June
days from,
1st.
right? And it's
Now
like,
it's
no,
now it's this Saturday, this
now it's
Friday.
this Saturday, like, you know.
Dr.
So
Blessman, that link that you had, Miss Shirley, on the invitation, is there any way you can copy it and paste it in the chat?
I'm trying to find it now. Give me a minute. You know, because I also want to say that, you know, there are better quality air purifiers. Miss Shirley and I both have an air tamer. So,
And several of my family and friends have them. So I'm sure they're going to feel very special because they have the top of the line and they have their air caves
mhm.
that they're
So,
bringing.
we know that this product is field tested and it's good, and it lasts for 150 hours on a single charge. So this is the kind that, you know, remember we talked about if you were traveling and you need something that was reliable, that was going to last for a significant amount of time. I would really suggest, you know, one of these. Like for you, Michelle, I noticed that like when you were traveling, like if you missed a plane or, I
Yeah.
mean, stuck somewhere, you know, and you only got like 6 hours on the
Right.
little like this kind of ionizer, which is the kind that we're talking about for the party.
Right.
These only lasts what, 15, 20 hours or something like
Mhm.
that. So if you're a traveler, it may not cover you for the entire time. Plus,
Right.
once you get to your destination and then the next, you know,
Mhm.
but I'll put it in there.
Okay.
You know, because I mean, you know, everybody can think about what they need. I mean, maybe some people may only need an ionizer that will work for an event, you know, because they're not traveling or anything like that, but they just need it to last during the time of an event. And there's a bunch of them that do that. Here.
I can tell you that the one that I do have when I had my mess up last week, but I have had this ionizer on every trip and I have not tested positive for COVID yet. And I work in doctor's offices with patients all day.
You have your mask on?
Yes, I have my mask on, but this training, I'm in a room, I have my ionizer and I have my air cave blowing. So I'm not this week, I don't have to wear the mask as much, but next week I will be because I'll be at the front desk.
Okay, so we've got a couple of questions in the not in the chat. Carol, Miss Wright asked, are ionizers safe for people with asthma? Actually, it's recommended for people with asthma because the air is pure. You're removing the allergens and the bacteria and the particles out of the air, so that the air that the person with asthma is breathing is much cleaner and fresher and more pure. So it's actually great for people with asthma. Um, uh, Birthday party in January. Thanks for sharing. You're welcome. You know, and I hope that you want to make sure that he's healthy and that he's safe because he's 90. You know, when I go visit and I make sure that I test and wear an ionizer before I go visit them. Because they are 90, I know that it's much more challenging for them to talk to people with masks on because they need to see the entire face. And sometimes if older people might have a hearing loss problem, and so they want to get closer to you. So I really think that they should, not only do I wear an ionizer, I bought ionizers for my two 90-year-olds 90-year-old colleagues that I go visit. So I bought one for them too. Oh, okay, Krista, yeah, you're gonna consider this for your birthday celebration? Yes. So, and can you put the link? Okay, I got the link for the ionizer in the chat. Is the one you had on in the earlier, is the one you had on in the earlier photo. The one, this one that I had on that was around my shirt, they're just coming back into stock on Amazon, but they won't be in for like 2 months. So I'm just saying, I bought these like last summer. And I was miffed that I didn't get more. It's like, oh, okay. But they will be available. If you order now, they should get here in a month or two. That's what they're saying. Okay, and then the link for the ionizer is in there. Okay, now is there anything, were you able to screenshot or do I need to put it up, the requirements for the party for Shirley's birthday party? Are people interested in that? Because I can go back to.
I did a screenshot of it. Really good.
Because you can ask, but you did say you got it in the chat, right, Dr. Blessman?
No, it was a picture of the back of her.
Okay.
Of her invitation. It was cute too. The invitation was cute. It had jazzy music. You open it up and it comes out, and it was a digital invitation. And then, you see all the basic information on the front, and then she's got this great jazz music playing, and then the card flips over, and on the back it has the requirements. So I'm going to go back to screen share and put that up so that people have a chance to screenshot that back of the card, the back of the invitation, the digital invitation. Here, let me make it larger. Slideshow, here we go. Okay.
Dr. Blessman.
Yes.
While you're doing that, this is RV. I just want to thank Shirley for sharing this information about her party. I'm excited to plan one in a few months. And this is excellent. And her team, and for you, Dr. Blessman, the way this is outlined, it's clear. You can have a party and have an event inside or out, knowing that everyone have done everything they can for protection and still enjoy yourselves. So I appreciate that, Shirley. And
Thank you.
I just want to say again that this has just been incredible information once again tonight. And I took a look at Coachella in terms of the spikes. They had, and like you said, 125,000 people a sellout for all 6 nights. But it was outside in the desert, which we know the winds blow, on 650 acres of land, and those numbers were still that high.
Right.
So it was really good information, and I appreciate all that you and Michelle do to bring this to us.
Mm-hmm. Okay.
Thank you, Doctor. Thank you, Doctor.
I appreciate you.
So I wanted to share this with you guys. So I have, I'm not as smart as a lot of my friends. I'm smart in what I'm smart in. So this lady called me and she said, Shirley, you're always saying that you don't wear heels and you want to be comfortable. And so she said, so I saw what you were thinking about wearing. And she said, so have you thought about wearing some bling bling tennis shoes
Oh, that's cute.
with your outfit? And I said, oh, okay. Then she called back and she said, so why are you going to be the only one to get to wear the bling bling tennis shoes? And I said, well, you just brought it up. I'm concerned about how I'm going to look. Because she said, so how about doing this? How about making it a contest?
Okay.
Send a notice out to everyone that's coming and let them know that there's going to be a bling bling tennis shoe contest. We can put together baskets. We can even put together a panel and we can choose the best bling bling tennis shoes. And then all the ladies will be comfortable.
Yes.
And dancing.
Yes.
And feet not hurting. Because after you get, 55,
54.
So I thought, that is really, that's unique.
Mm-hmm.
So I'm really happy that I'm surrounded by people who are willing to feed me ideas, and I'm making sure that I'm open to everything. And so I can just imagine that most of the ladies and probably some of the men are going to be really up for that.
Miss Shirley, I got some bling bling tennis shoes. I didn't get an invitation, honey. I will crash your party.
If you want to fly in,
I might have to, Miss Shirley. I got me some bling bling tennis shoes.
So
we're gonna put you on the COVID squad if you do that, Michelle.
I had not had a chance to share with you, Dr. Blessman, but I just thought that was pretty unique for the people who wanted to participate, who wanted to not wear their heels, because a lot of ladies were already saying, oh my God, I'm gonna wear my heels in, and then I'm gonna put my low shoes on or my comfortable shoes. Or I thought to myself, I know my feet hurt all the time. Okay, so I don't even want to walk down the hallway in any heels. That's out of the question. I'm not doing that. I may fall and break another hip. So I can start off with my bling bling tennis shoes on.
There you go.
So
wear your bling bling tennis shoes all night. I know they're gonna be fly.
Yeah, they're gonna be fly.
I know they're gonna be fly. I know they are. It's gonna be real fly.
I'm trying to figure out how I can make me a matching mask, because I'm gonna wear my mask.
Okay.
Even though, I'll take it off some, but I'm gonna put it on.
You got your bling bling mask.
Huh?
You got your bling mask.
I'm gonna make me one. I'm gonna figure out how to make me one to match the tennis shoes.
Yeah.
To match the tennis shoes. Okay.
Ooh, you're gonna be fly.
Not that she'll need it, because she has her ionizer. We got room purifiers and all that.
Yeah.
But it could be cute.
It'll be fun.
You can show people how to be cute and do this. Okay.
That's right. That's what my girlfriend was saying. She said, do you know how many of us want to have a gathering, but we have not figured it out?
Right.
And what you've done is kind of helped us figure it out. And now I'm going to do mine. And I said, great, we'll have lots of things to go to.
Absolutely.
Need to go buy me some more outfits.
There you go.
Looking forward to seeing
all those clothes that that we've been throwing and tucking away in the closet that we haven't been able to wear for the last 2 years, right?
Exactly.
But yes.
Please share pictures next week.
Pardon?
Please share pictures next week.
Well, the parties are a ways from now, but we will share
sorry, I
pictures.
thought you said this Saturday.
No.
So we got
what? My birthday was actually May 4th, but it's always really cold. And I made a decision. I was not going to have anything in the cold weather, period. So I decided to go with June the 11th,
That's sweet.
thinking that it's closer to the 4th of July.
Mm-hmm.
Right.
The likelihood of having better weather
Mm-hmm.
may be higher than doing it around last week, which it was cold.
It's going to be beautiful June the 11th. It's not going to be too hot. It's not going to be too cold. It's going to be perfect.
Right.
Exactly.
Mm-hmm.
We can wait. We can wait until June for pictures.
Yeah. I kind of hate that I had to shut the RSVP down. I never thought that many people would respond. I really didn't. So it's a lot of lessons that I've learned from the behavior of people at this time during the middle of the pandemic.
Yeah.
So.
Well, Miss Shirley, if you're any, I know that this is a huge milestone. I know how old you're turning, and you're in my mom's age group, although my mom's older than you are. And so I can only imagine of your friend network, how many people have died, right, within their own families, friends they know, right? And they're concerned. And they still, and they're like, dang, everybody is out enjoying themselves. I want to get out too.
Well, I knew that I could count on Chicago.
Oh yeah, that's Chicago.
But I never thought that people would come in from Houston and Miami and Maryland and DC and Philly and all those different places. So these are people that I haven't seen, some of them 20, 30 years, and some of them are from work.
Wow. And they want to get out. They want to do stuff. They got money saved. They haven't gone anywhere. They haven't taken any grand vacations. And this is grand. Right. This is a grand celebration for a grand queen diva. And this is just a perfect opportunity to get into their glad rags and show off.
I have a friend that we were so close in the 80s. We were like 3 Blacks. And we were winning all the awards. And we hadn't talked in a really, really long time. And he responded. And I found out that he owns a restaurant in Barbados and a beach house in Barbados. And I'm saying, oh my God, I could have been there a long time ago.
They had your number speed down.
Yeah. So it's good to,
that's gonna be
rekindle relationships, because the pandemic has kind of isolated us, and we talk to the same people all the time, and so it's definitely open up.
Oh, of course. And then you gave them some guidelines on how to be safe.
Yeah.
And that's like 75% of it. Like,
right.
Hell, am I gonna leave Chicago with COVID?
Yeah, and then there's a couple of older gentlemen who are in their, one is 82 and the other one is 76. And they said, Shirley, we don't have a lot of money to buy your gift, but what we will do is we will go across the street as many times as we can and load up the cars and bring people across the street. Because, we know those ladies are going to be wearing those high heel shoes. I said to myself today, well, I think I got that problem solved. So, but I think the generosity of people is, you're right. They want to get out. They want to have fun. They want to feel safe. And, if they don't know how to navigate, they're watching us to see what we're doing. Yeah.
Correct. And it's a big service to our community that we show them through example how to do these things and how to have fun and how to do it safely. So, I'm excited about that.
Me too.
Ms. McNair said she was going to use some of this for her mother's 90th birthday party for a drive-by. I said, okay, so make sure you and your mom or anybody else that's going to be greeting all these people, make sure they have on, make sure you and your mom have ionizers because you're going to see
Yeah.
a,
Right.
yeah. So, um, you know, the people in the cars may not necessarily need to have one or want to have one, but you and your mom should have one.
Mhm.
Better see, because if you stop and talk to somebody, 3 minutes, that's all it takes.
Yeah,
You
we
know.
had one for my dad. It was and it's kind of late, one planned lately, or at the last minute. And so the plan was for him to sit on the porch or by the porch and see the cars come by. Well, we couldn't keep him in the chair because he was like, I done broke out of jail, and so the cars started coming by, and of course it was relatives, and most of them had masks and stuff, but then they started getting out of the car,
Right.
and so I mean, it's people that he hadn't seen in forever, and he doesn't go anywhere other than to the doctor's office. And so, but I did have this one cousin that came late. She brought two young kids from another birthday party. So we were like totally upset, and just made herself walked in the house because we didn't have anybody outside the immediate family invited to come inside. And she came inside, and it just, we just kind of cringed because nobody else had on masks, and we don't know where she came from. She had the kids, and so we were blessed that nobody got sick. But I mean, that was a big risk,
Right.
So we're gonna be a little bit more to the detail for this one.
Correct. Good. And I'm hoping that we gave you something to think about in terms of how to make it as safe as possible for your dad and for you.
Yeah.
Um, um,
Yeah, because my
and-
mom was like, "Oh, I don't need to have one," because my dad turned 89. My mom turns 90 in June, and
She
she
needs
said
to
we can
have-
just wait. Yeah, we could just wait till next year and do one party when we both 90. And I'm like, "Oh no,
party.
we doing another one."
Okay. Yeah.
Mhm.
Well, just make sure that they have ionizers and skin guard.
Yeah.
It'll be good.
Mhm.
Yep.
My two colleagues are 90 and 92. No, I'm sorry, 92 and 97. And they have a hard time keeping the mask on their face, and and they don't really like them anyway. And there are elders, and like, okay, so but they love their little ionizer. They're like, oh, they'll wear that, no problem. So they just say, I got them a little special gift so you can talk to people and you can see their faces and you're protected. They loved it.
That's awesome.
Because
I
it
think
made
the
them
only-
feel special.
I think the only problem,
Mhm.
I think the problem, I'm glad I'm hearing this for my grandson's graduation. My daughter could have put on back of her, the invitation, something about, being careful about the COVID, and she didn't. So I don't know. I'm going to talk to her tomorrow and see what her thinking is. She's very careful about everything herself because she's just that way. But I don't know how we're going to approach the people now.
How far in advance are we? Are you a week out?
Yeah, we're a week out. We're about the 20th is the graduation on the 20th.
If you have emails, you can send out an email to everybody. Because I think we still have, Shirley and I are planning to send out, even though we have the invitations and stuff, we still plan on sending out at least one other message to people.
Mhm.
And it is, I already have the language for it. While we have presented to you the best that is scientifically possible and have far exceeded city, state, and federal standards, there is no guarantee expressed or implied that those attending this event will not be exposed to COVID-19. We pursue this level of excellence because you are valued, you matter, you are worth it, and we are committed to helping you stay as safe as possible.
Oh, yeah. Oh, well, text that or email me that little part and we can pick and choose.
Right, and then you can just, put in whatever your requirements are going to be. and
Yeah.
text.
And
And
my girlfriend had a suggestion that I took up too. She said, "So what will you do if someone shows up and they don't have the ionizer? Either they forgot it at home, they left it at the hotel, or what are you going to do?" And obviously, someone has bought a flight, paid for a hotel. There's no way that I need to be not trying to figure out something, right? So she said, go in and buy 12 or 15 right now. And then if they don't have it, she said, maybe you can take 5 or 6 of them, charge them up before the party, and you can sell it to them.
Okay.
And then you have it. So that's my backup plan, because I can send them back if I have too many. But I mean, they're just so inexpensive. I doubt if I'll ever send them back. I'll give them to somebody's senior person or somebody whose life I can help. Because I got them when they were $13 and something. I grabbed them then. Because actually, I don't believe that they were moving, and then all of a sudden we bought them out. And then that company had to replenish.
Are they out now?
No, they're back in stock.
Okay.
They're back in stock. But they're not $13 anymore.
Okay. But there's a bunch of them out there. I mean, it's not like you gotta buy that particular one. As long as it's several million ions per second. I like the rechargeable ones. There's some, what can I say?
I was just gonna sell them for $20 if they didn't have it. But I'm also checking with everyone to make sure that they've ordered them. And there's not a lot of people who haven't ordered.
Okay.
So
some people don't know about it.
Yeah. Because
Well,
I did
thank you for
say
the information.
I did say it was required, just like the RSVP. That's another thing we don't do. We don't RSVP. We just think we can show up. I made it very clear that with the high security and all of the things that are happening throughout, there will be no entry into the building if your name is not on the list.
Okay.
So people have changed that little behavior they had about
RSVPs.
Yeah.
Okay, well, thank you so much, Shirley. Dr. Blessman,
Sure.
you could just text me that or email me that information. I'll give it to my daughter and she could just work with the best she can.
So I put the statement in the chat. Was there something else that you needed?
Maybe something about the ionizer. I know you had that ionizer, and you know what? I hit the wrong thing and it erased the whole thing about the ionizer that you had sent me. If you could just, I hit that wrong button accidentally and just took it away. So if you could send me the information about the ionizer again, I appreciate it.
Okay.
And I'll tell you that there's a lot of information there. There's 4 or 5 examples of it effectively working. There's a lot of write-up about how it works, why it works. And so if people go into that site, they really don't have a lot of questions after that.
Okay. Sounds good. Appreciate it, ladies.
You're welcome. Well, Dr. Blessman, I tell you, this has just been another phenomenal conversation. I'm sure last Tuesday was just completely off the chain, and I really hate I missed last Tuesday, but today tonight has been good information. The book that Dr. Blessman is reading. What's the name of that book again, Doctor?
Emergency,
Mm-hmm.
Healing and Heartbreak in a Chicago ER.
This Dr. Foster is dynamic,
Oh.
and we're going to do all we can to get him on the program. Since he's been on Chris Hayes on MSNBC, and since that appearance, I don't know how hard it will be getting him, but I think that because of the diversity of our group, and you know, the majority of you all are in Chicago, I can see him coming and giving us an hour and a half of his time. We'll definitely.
Can you say it one more time? I just found my pen. Say the name one more time.
Doctor, emergency.
Oh, I'm sorry. Thomas Fisher, MD. And the book is called Emergency, A Year of Healing and Heartbreak in a Chicago ER.
Yeah, he's definitely inside Chicago.
Oh, it is riveting. I mean, he's he's an excellent writer, and so just listen. I've just been listening to it and just thoroughly enjoying.
Wow, I can't wait. It sounds very interesting.
Yeah, Dr. Fisher, he's right in y'all's backyard.
Yep, he's at UFC.
Is he UFC?
Yes.
UFC. Okay.
Mhm.
So it's University of Chicago. Yeah.
Ms. Brown, do you have my email? She wanted me to send.
I have your email, Dr.
Can you
Blessman.
send me a text email real quick, and I'll send you the list of ionizers that I've purchased.
Okay.
So next week, more of the same. With there is B4A and B5, BA.4, BA.5. And we have some cases in the United States that have been detected. I put the link to the article in the chat if you want to take a look at it. I'll paste it again. Christy brought it up earlier this evening about these new variants, and there is some information out there on it. So I'll put the link in the chat again. They're there, and they're different than the other spikes, other variants that were connected to the Omicron. This is different.
So, Michelle, I have my nephew is 29, and he's in Bangkok, Thailand.
Yes.
And he has been sharing with me some of the pavilions that they go through there. Like he tests every 3 days. They test before they go in restaurants.
Really?
Etc. And so he has agreed, because 8 o'clock here would be 8 o'clock a.m. So, but he has agreed to come on at least for about 15, 20 minutes and just share with us what they're doing there. And he's a young man. So the fact that he's excited about the compliance there. And, he says, I've taken 20 tests at least, because all of my friends, we take tests every 3 days. So there, and he said, when I go to people's homes, you have to keep your mask on. No one takes their mask off. So I thought that was a really great thing, because I was concerned, of him going there at this time of his life. I said to myself, I need to be worried about myself. I'm down here with all these fools.
Right? We just take this thing really for granted. I'm serious.
Yeah.
I'm down here. I watch them. in the morning, I see the workers. Well, I did talk to one guy here in Louisiana, white man, older white guy. And he had that, well, I don't trust the government. And I said, well, if you give it some rationale, why would the government kill all of its citizens? They have to have somebody to rule over. And then they talked about, oh, well, it's population, depopulation. Okay, it is that. But why would you not take the vaccine? And then I did tell him, I said, well, there are other platforms, but they're so stuck on not taking the vaccine, right?
Mhm.
So, of course, we still have that segment of our population that just refused to take the vaccines. And with the BA.4 and the BA.5, being vaccinated will help, right? Being vaccinated will help. So if you're not vaccinated, dealing with the BA.4 and 5, you're going to run into some problems.
Real challenge. Yeah.
And there was another article, Michelle, that I read that some people are getting blood clots from Plavit or whatever
the treatment. Mm-hmm.
Yeah, so they're not going to be able to get that. So you have to just really exercise our safety protocols.
Period.
And there are some people, like you shared the story with us about your son's ex-girlfriend's mother.
Yeah, she's gone.
My new trainer shared the story with me. It was like two of them. One lady was a retired cop, and she always would exercise, and she was an EMT, and they're in New York, and she took the vaccine, and then she had like a female surgery, and she basically never recovered. And he went to her funeral this Saturday. He and my cousin goes to his facility for training. And then he told the story of one of his close friends that her husband and she traveled to, like, I don't know if it was Amsterdam or somewhere, but he had taken his booster and he was fine through the flight. But when he got off the plane and went to get their luggage, he died at the baggage thing. Do y'all know why he died? Michelle, you don't look at me like that.
What?
Do you know why he died?
Did he take the vaccine before he got on the plane?
No, he took the booster several weeks before. I mean, do you understand why he actually passed? Well,
No.
there are many Black people that we're finding out that they have some kind of blood clots. Okay, and
yep.
And their disease, and while he was flying, somebody should have the blood clots must have been forming. So when he got off the plane and when he went to bend down to get the luggage, the blood clot shot straight through his heart. He was gone. They did an autopsy on him because they had to rule out foul play because he was overseas. So I just need y'all to be mindful. It's like, be cautious about it. And if you're flying, I don't know if anybody ever told y'all this, take an aspirin. If you're on a long flight, and especially if you're getting older, just take an aspirin. That will prevent you from getting blood clots. And I said that to him because the trainer, he was going to med school, and they really don't want him in clinicals because he's hardcore like us. It's like he shoots down everything. And he was like, he had asthma just like I had childhood asthma. He said, I had all of that. And it's just like, you have to take care of yourself like we're doing, because nobody in America is going to take care of us. And that's what he says. And he trains people all over the world. He actually trains people like Mary J. Blige. They have gyms all over the world that he trains at. And so for him to say that, I thought about the story you shared with us, Miss Michelle. It's like, I just need people to be mindful, especially if you're not a person that goes to the doctor and you really don't know your health status.
Right. That's right.
And I think that's a lot of the problem in the Black community, because we do not go to the doctor.
We don't go.
You know? So it's like, this group is excellent. I love this group. I really wish I could get some more people to come to this group. I'm working on some of my military neighbors and my friends, that I have a lot of them. You know, that conversation we had about the Black man last week is real. I know that the doc didn't really agree with me about it, but I talked to one of my neighbors. He's a combat vet, he and his wife, and they don't talk about stuff, but he and I were talking about the number of vets that are killing themselves. And when I tell you that's near and dear to my heart, I had a cousin that we said that he killed himself when I was like a sophomore in college. And so I've seen so many soldiers, like I said, that there's nobody home. So the conversations we have, I love it. I love this group. And like I said, I just want us to thrive and be well.
Yes. And we are. It's just a matter of getting our people on board with it, right? So the pulmonary embolisms are a real thing.
Yeah.
And if you don't know if your blood clots, then that's something that you need to find out. We're gonna wrap it up because it is getting late, but I was watching a program and Malcolm X it was a brief quote that he had said about voting in politics. And he said that we can't, and I'm paraphrasing, is that we cannot rely on these politicians to explain anything to us. We can't, education, we have to educate each other about politics and politicians and what it means to vote. Because that's only the only real tool we have, and that's slowly being chipped away. And then, with all of the different legislations, who knows what it's going to be if we don't get on the good foot with voting our interest. And that goes the same with this virus. If we don't educate our people, if we don't get educated and be resourceful, then those numbers that Dr. Blessman talked about, when she was giving her presentation and I was answering the questions on mute. So the question that she asked was, well, how many, people at Coachella, what was the transmission rate, right? And we were all like 30%, and it was blown out the water. But when she did the assessment on Black people, she said, well, if you have a assessment that says, 3% of the population is hospitalized, then I said double. She said triple. So we want to be part of this America that's counted like, oh, okay, it's only 2%. But that's not what it is when it comes to us, because our care is different. We have no access, low access. And then Dr. Blessman, I was reading one of her posts on Facebook where they had to literally fight to get her cousin out of one hospital to another. And I'm like, well, that's my fault. Girl, put your clothes on and let's go. But it's not that easy. And if her cousin didn't have advocates, then she would have stayed and remained at a place where they had decided to stop her care, where another hospital said, bring her here, we'll take care of her. And so, it's just rough for us all the way around. But with this COVID, it's not going anywhere. The mutations are coming and they keep coming. And eventually it's going to be something that we're not going to get rid of. And if people don't want to wear masks today, they might be wearing masks for the rest of their lives, because that's the only way that you're going to be able to negotiate living with this kind of virus. And we don't know what tomorrow is going to bring. But we're most certainly gonna stick and stay. Dr. Blessman says that's what we're gonna do, and that's what we're here for. We're gonna definitely do that. Dr. Blessman, this was an awesome presentation, awesome PowerPoint. I know you put a lot of time in it. I can tell. It was awesome. Thank you. I'm going to read that assessment, and I'm going to go ahead and download the book in my Nook so that I can read that too. So we'll be ready for Dr. Foster. So that's what I'm going to task everyone to do, because my task is to get him on the program. And if I get him on the program, then you got to read his book. So when he comes, you have to ask questions.
Right.
You have to engage him. And then he'd be like, Dad,
Okay.
it's like great.
Right.
Justin, any final words? Anything you want to say?
No, I think this was a great and robust conversation, kind of as usual. It's nice having, you know, a solid to come to every week, knowing that we have a community and a tribe. That I've used the word tribe, I think, several or a few times.
It's your tribe.
Especially in this pandemic,
Especially
having that sense of family is important, because you
It
touch
is.
on every sense of aspect of our culture and our community, and the fact that we can't do it all alone, and the fact that it is like a spider web of information. Someone might be having an event that now you can now host your own later on in the summer, because someone else in your community shows you how to do the breakdown of how to host it correctly and how to invite people. And now you know where to go in case you need, you know, a cheaper ionizer, or you need at least an idea of where to shop around, because you know your fellow member led you to that door. Now it's your objective to get through it. There's a lot of tools that are offered and shared and spoken about, and I think it's good that we put a lot of practice behind what we preach. And then we actually come back and talk about it and say, hey, this worked. Hey, this did not work. Don't do this. That's a sense of survival. That breaks it back down to how man created X, Y, and Z, and how man defeated X, Y, and Z, was that sense of communal activity and communal survival mode. We just put our spin on it to thrive, because we like to travel and we like to get other things done besides just hunt for fish.
okay, hunt and fish. I need to do a little bit more hunting. No, I'm tired of being single. Don't you say nothing, Mr. Eddie Joe. Don't you say a word. All right, Dr. Blessman, I think that's all we got for tonight.
Yes. It was wonderful to see all of your faces. I love you.
Love you too.
You know, our goal is to thrive, not just survive during this pandemic. So go out there and live a joyful and robust life. Give it all you got.
Yes,
Okay.
ma'am.
This is the only one that we know we got. This one.
This one.
Right? See you
right.
next Tuesday,
See you
7
next
p.m.
Thank you.
Good
Thank
night.
you.
Thank you.
Good night.
Good night.
Oh, yeah, good night.
Good night.
Good night,
Appreciate
everybody. Outstanding, Doc. Outstanding.
As
Thank you,
usual,
Dr.
as
Cato.
usual.